there is a medical college now with the India, whatever we have now, around 850 medical colleges across the India. And most of the BPL patients, they get the life-saving treatment under free schemes from state government and national governments. Only thing what's lacking is the poor networking with the available resources to the targeted population. So there are multiple voluntary services which are filling this gap in India. Like in our state where we have a NIMANS, in Satsa Institute, there's a SWIMS Institute, and there's a weird, like it is very close to the area where I am doing the charity work. These are the well-structured institutions. They are providing some services, but there are other unstructured services like a lot of clubs and societies that are providing the charity care. And I also involved in multiple charity cares, from the small to the bigger societies like Guinness World Record kind of thing. But this is one area where we are working. This is a small hospital in a village. This is a charity hospital started by one philanthropist and a businessman and a good human being. This is around 50 kilometers from the west coast. It is situated in the West Godavari district of Andhra Pradesh. It started around 10 years back with minimal support services like a small OPD blocks like that. And slowly it is added other sources like physiotherapy care and other cares have been added to this small village setup. And he's been awarded some PhD for his philanthropic work. This center where it is located, a lot of medical colleges and the surrounding medical institutions, they come there to the hospital. We provide a quality care to the, there's a qualified doctor situated in the center. Visiting doctors come from surrounding places, nearly 20 to 25 super specialty and specialty services have been provided on a regular basis, 24/7 on weekly basis. There's a blood worker, freely blood worker facility are available in the center. There's a discounted pharmacies available in the center. Physiotherapy and dental treatment and podiatric care will be provided to the selected patient in the center, and complicated cases will be taken to the referral hospitals. Free of cost service will be provided. There will be 24/7 free ambulance service to the referred patients that is available. One good thing is free food is provided to the most of the patients who are visiting to the referral hospital in the center. So as I said, doctors and patients comes to the one particular area in the hospital, and primary screening will be done in the center, and the referral cases will be taken to the referral hospital to provide the further specialty care to them. So some non-medical support systems are also involved into this. They are people like non-medical people. They come and do the service for providing the food, providing the patient segregation, and providing the little bit of transport services to them. They are available within these premises. So what neurosurgery services we added extra to what is being done? I do a monthly once free service to the patients, and physiotherapy center was added around 3 years back because a lot of trauma and stroke patients comes to the center. So that is the main lacking to these people actually. And we also added discounted imaging services like CT MRI are very costly. We called upon 2 or 3 centers available within the 25 kilometers radius. Now most of our patients, they get 2,500 MRI scan for brain and spine. They can get the MRI scan, and for 1,000 rupees they can get a CT scan when directly from that particular center. So that's how the patient population has increased significantly. On an average over a year period, 1 lakh patients are screened in this small village voluntary service. And coming to the neurosurgery, we have done around last 10 years. I personally treated around 10,000 patients over the last 10 years, excluding the 2 years of COVID where we have a very less patient volume. When you have the age distribution, most of the patients are 4th to 6th decade of time actually. And if you observe closely, we took 1 year data. The female patients are more seen than the male patient because they are the people who are little neglected in a village setup. They are not taken to the specialty care to the other main centers. We try to analyze the disease-wise cases, how they are If you see the diseases line, 2/3 of the cases are not actually the patients actually. They are all the degenerative diseases which are coming to the geriatric case group. So they need some kind of care, they need some kind of consideration to assess them and then talk to them and give some kind of rehabilitation care. So they will be alright to have a proper lifestyle over a period of time. What other observation we made, 2/3 are suffering from age-related disease. They are not a serious diseases. You just need a proper counseling and some rehabilitation. Post-trauma and post-stroke are the major burden in the village setup. Most of them, we treat the primary care in the hospital, so specialty hospital. When they were transferred to the village side, they are neglected because of this lack of rehabilitation services. Adding a free rehabilitation center made a lot of patients recover fast, and then they are coming back to earn their livelihood also. So bridging the gap, what the role of the small village healthcare setup we established is that kind-hearted philanthropic work will added to develop a network between the medical college, private hospital, diagnosis centers, private doctors. Many doctors, after seeing one after the other, they are joining to do the free service for weekly or monthly. And some temple resources also, they provide some food on one particular Thursday. There is a Sai Baba temple near to that. They provide a free service and free food to all the visiting patients. The close monitoring of the patient, unlike routine like voluntary camps, what they do, they just come and do the screening and they go away. But this particular society is doing from one end to other end. We are following the cases to the complete treatment of the patient and also following up their disease also. So not merely conducting a camp, but we have created a system, an ecosystem where patients have been screened, diagnosis, physiotherapy, referral to the referral hospital free of cost, and imaging is done in a subsidized manner. Follow-up and free food is provided, free transport is provided. Charitable partnership with the rehabilitation services are making them building a sustainable neurosurgical network is very important core of this experience over the last decade. So how this sustainable model is made? This is the future of healthcare is not merely building the big hospitals and big number of hospitals. It is building a stronger healthcare ecosystem. Every volunteer service that create a local capacity, improves access and ensures the continuity of the care according to the NITI Aayog standards. We are trying to match those gaps individually. Together we can transfer the compassionate services into a sustainable rural healthcare system. So in conclusion, despite the competitive business and corporate environment, compassionate care and voluntary service continue to make a significant impact on the at least rural services and suburban services. Effective utilization of local resources and networking with the referral hospitals can help bridge the gap in rural healthcare to the technology what we are seeing in the higher centers. Taking some personal time out of a betterment for the mankind is not a difficult as it may seem like. Thank you very much for your patient hearing.
Thank you very much, Dr. Ramesh sir. I think it is commendable what you are doing for the rural